Respiratory diseases. Respiratory diseases are a group of pathological conditions affecting the organs and tissues that make gas exchange possible in higher organisms and include conditions of the upper tract, trachea, bronchioles, alveoli, pleura, and pleural cavity.
Changes that occur in the lungs if you have chronic obstructive pulmonary disease. Click the navigation arrows below the animation screen to play disease, or COPD for short, is the term used to describe long-term conditions affecting the lungs.
The importance in Ecuador are because these diseases are responsible for over 10% of the hospitalizations and over the 16% of death. For example, tuberculosis.
Introduction. Tuberculosis, or TB, is a bacterial infection that causes more deaths in the world than any other infectious disease. It's about 20,000 tuberculosis causes. Tuberculosis is an infection caused by a bacterium called Mycobacterium tuberculosis.
Okay, the classification. We have inflammatory lung diseases, obstructive respiratory, pleural cavity, pulmonary, vascular, and neonatal.
Since emphysema and chronic bronchitis are each usually caused by years of cigarette smoking, afflicted individuals are almost always diagnosed with both at once. Hence the umbrella term.
The pros and cons, and in Ecuador, due to the weather changes, we have big amount of patients with respiratory diseases, such as asthma, tuberculosis, and emphysema, that, with an incorrect or late diagnosis, lead to the death of the patient. Asthma is a common chronic inflammatory disease of the airways, characterized by variable recurrent symptoms and decreased airflow, and wheezing, coughing, chest tightness, and shortness of breath.
During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract.
The pathology of the asthma is caused by a combination of the genetic and environmental factor, as we already heard, and the clinical manifestation will be that your expiratory volume will decrease, you will retain more air on your lungs, but your inhalation will be very, very low. Yeah, the emphysema is a type of chronic obstructive pulmonary disease involving damage of the air sacs of the alveoli. As a result, your body does not get the oxygen it needs. Make it harder to catch your breath. You may also have a chronic cough and trouble breathing during exercise. As you can see on the picture and on the video, normal alveoli have walls, but in an alveoli with emphysema, the alveoli are damaged and the walls break down, so the exchange of gases will not occur like in a full percent. The causes and management: smoking, air pollution, occupational exposures, and genetic. You can manage the disease with exercise, bronchodilators, corticosteroids, oxygen, and surgery. Thank you.